6:35 here on Morning Barbados. We're continuing to bring you good news and information, and one gentleman who is very good at doing that is our doctor on the line, Dr. Adrian Lord. He is in to answer your questions, your comments, your queries, or just to have a general discussion about good health. He, of course, practices what he preaches. We interrupt his 4 o'clock in the morning walk every Wednesday when we ask him to come in, but nonetheless, he does it quite happily. Please call us at 228-5562 or 228-5563. We are on Twitter or Facebook. Send us your questions, comments, or queries. Doc, good to see you again.
Morning. How are you doing?
I'm great, thank you. Looking forward to my loud tickets.
Oh, okay. Loud.
Loud.
Yeah.
You wanted to address something that a caller brought up last week before we get into the rest of the program.
Oh, yes. Thanks for reminding me. Last week, someone called about tropical spastic paraparesis, TSP. Obviously, she's a sufferer, and she wanted some advice, and I advised her to go ahead and see one of the neurologists here. Just for the public's information, it is a condition, as I said last week, it's caused by the HTLV1 virus, which is human T-cell lymphotrophic virus type 1.
That's a lot of words.
And it is a progressive disease which causes muscle stiffness and weakness in the muscles, and nerves become inflamed, and you get numbness and tingling along the limbs. It's not very common. It's rare. And we only found out the cause of it about 30 years ago. It's only in the 1980s that the virus was identified. It's not fatal, but of course someone with stiffness in the muscles and weakness, and then you can get eye problems, joint problems. And many people out there say, oh, I probably have this thing. You probably don't. But the treatment is also symptomatic. Sometimes you can use oral steroids to treat it, and other drugs which help with bladder control and sphincter control, because sometimes you have urinary incontinence and so on. So it's not a common disease. It sounds terrible, but people live for many, many years with this condition and die from something else.
Okay. Look, I want to ask a question, because when I was living in Toronto for a while, you'd hear an outbreak of this here, an outbreak of that, and then you'd be thinking, but in the Caribbean, you don't generally hear all these things happening so much. Why is that? Is there a specific reason? Is it the air we breathe, or is it just that fewer people that come into contact with each other?
We probably don't identify these things as much as in Toronto and other places, but we have an epidemiological unit here in the Ministry of Health. We know the outbreak of the infectious diseases, dengue. Sometimes you have a outbreak of red eye, gastro, and so on. And the Ministry of Health in Barbados, they do monitor through the public health system and the private health system the number of viral illnesses that they do occur, as well as at the air and seaports. There is staff to monitor people who may bring in these communicable diseases to Barbados.
Okay. Crop over is another thing that is in the air, and one of the things you may want to remind people about is how they can be safe as they jump, as they enjoy themselves. You know, there's a lot of sweat out there, a lot of sneezing, you know, things like that.
That doesn't only happen during crop over.
I know, but you're closer then, you know.
I suppose, yeah.
People are, you know, enjoying their merriment.
Yeah, crop over, you get large numbers of persons at events, outrageous.
In red?
In red, yeah, last Saturday night. Saw you there.
I didn't see, did I see
on television. I was in the tents.
Okay.
But I heard it went on to 5:30.
Probably. I left at 1:45, so.
No, thanks.
Your medical opinion on that?
I need some sleep. Yeah, there's sweating, and there could be transfer of some skin diseases, some viruses. I wrote an article recently about hepatitis, which can theoretically be transmitted this way. People use others' bottles and so on, salivas and so on. So these things can occur. So just be careful and use proper normal hygiene, and you'll make it through crop over and Rihanna Loud and wherever else.
Colin is cringing.
Yes, he is.
Absolutely squirming.
He's visualizing.
When you put it like that, Doc, you gotta stay home.
No.
But we have some callers on the line waiting, so let's welcome, first of all, Kirkley. Good morning.
Hi, good morning.
Good morning.
Morning.
I have a problem with spitting something like blood each time I wake up in the morning. And also, I don't know if this is related, but my head is itch me really bad at times. I don't have a scalp problem, I don't have dandruff. If I'm going to eat certain foods, it's really like salt and sugar. And that my salt and sugar is flour. It itch me really bad. And the only thing is really stop it is Arius. I was prescribed Arius and Claritine for the spitting and the itching.
Yes.
But I find the Clarius, it does not help the spitting. Right, so you could.
Okay, thank you very much for the question. The thing about spitting blood, especially in the mornings, it does suggest that you may have a postnasal drip, that your sinuses may be inflamed, and that is a collection of fluid and blood-stained fluid which drips the back of the throat, and then you spit it out on mornings. And you know, sometimes you might just be notice it. It's usually not so much of a problem, but you can get it checked out. And the same medications that you mentioned, the antihistamines, may be helpful in that condition. So it seems that he has a chronic sinus problem, or what we may call rhinitis, maybe infected, and may need some antibiotics in addition to that. As far as the itching of the scalp is concerned, he's using antihistamines. Those things that you mentioned are antihistamines. So obviously it's an allergic reaction to something, and not related at all to the sinuses. So although he doesn't identify a scalp problem, he should see a dermatologist and get it looked at, because there may be an antifungal or other cream that may be necessary to treat the scalp.
Okay, we have Gail who is holding. Good morning, Gail.
A blessed and a wonderful morning to everyone, because Angela
morning.
lovely.
Thank
Everybody
you.
has.
Good morning.
You spoke about shingles last week, and I would like to know what diet you can use. If there's something, if you eat something, if it will fit or whatever, if you could tell me about diets that you can use for those who suffer from shingles.
No special diet. If you eat healthy on a regular basis, then that would keep your immune system good. Eat a lot of fruits and vegetables, take multivitamins and that type of thing. That will keep your immune system good, and therefore the possibility against shingles or any other viral illness would be reduced. But there's no diet. But I remember the guy just now, he asked about eating certain, he took salt, sugar, and flour. So obviously he has a hypersensitivity reaction to those things, and he should keep away from those things until a definitive diagnosis is made. But for Gail, just eat healthy, exercise regularly, and you should do well.
We'd like to welcome Yvonne to the program. She's holding as well. Good morning, Yvonne.
Good morning.
Morning.
It's a godsend with this Dr. Morning.
Oh, we're glad to have brought him for you.
Yeah, Doctor, I want to ask a question about colon. Now, if you have irregular bowel movement and you notice that it is sort of persistent, but your appetite is not craving the roughage, and what can you do to improve your regularity? And I want to hear some more about this colon cancer. How do you go about getting the examination, etc., etc.?
Thank you.
Thank you.
Yeah, everybody doesn't like vegetables, and therefore that's a problem. But there are certain substances that are on the market you can get from your pharmacy or drugstore, which are high fiber substances. You take 2 teaspoons every morning with a glass of water, a glass of juice, or a glass of milk. And of course, the other thing would be eating, you know, the fruits, but not fruits. You don't take fruit, but cereals, which would have high fiber cereals. As far as colon cancer, in order to get it diagnosed, we tend to look at persons over the age of 50, or if you have a strong family history of someone who has had colon cancer, then you should have a colonoscopy. And that is where you're seen by a gastroenterologist who's a specialist, on referral from your doctor, and that doctor will then arrange for you to be checked with a colonoscope, which is a tube with a light column which goes up through the rectum. You don't feel it because you're anesthetized. You're given a local anesthetic so that you can relax, and you tend to be sleepy. When I had mine, I wanted to watch, but the doctor won't let me watch it. And the doctor views this thing on a screen and can determine if there are any lesions that are precancerous or cancerous. If that is so, then we can do a biopsy. And I don't want to call names, but I was so happy yesterday when a patient of mine who had a colonoscopy, after having had a scare from an x-ray, told he had colon cancer, and the colonoscopy showed that he had no evidence of any cancer anywhere, and he was so happy. He started to write his will, and he was 49.
Wow. Just goes to show that the correct information and being proactive about your health is important.
Yes.
We have, Colin, we have another caller on the line.
Yes, indeed.
Good morning. Welcome to the program.
Hello, good morning.
Morning,
Taisha.
Hi, this is my first time calling.
Well, welcome.
Yay!
Thanks. My daughter is 4 years old, and she was diagnosed with Bell's palsy about 2 weeks ago. I was just wondering, they said it was a viral illness, if she should have been given some kind of antibiotics or something like that, and if there's therapy or something that we could do on the face to help it come along, help build back up the nerves. Thank you.
Thank you. Bell's palsy is a facial nerve, a weakness of affection of a facial nerve is a weakness of facial nerve. So your mouth become twisted, just like similar to if one had a stroke. People get scared that they may have had a stroke. It has nothing at all to do with that. It's just inflammation or swelling of one of the nerves in the face, and just affects one half of the face. The eyes sometimes don't close well. The mouth, it may dribble, and it's just twisted a little bit. It can occur at any age. In her case, it was 4 years old. It was a virus, the doctor said, so there's no antibiotic. Antibiotics cannot treat viruses. Right, Colin? You know that?
Yes, indeed.
Yeah. So antibiotics treat bacterial infections. So there's no need for any antibiotic therapy. The treatment is just watchful waiting. You just monitor the child, and it tends to, in a couple of weeks, resolve by itself. Sometimes oral corticosteroids can be used if it's really bad, or, as you mentioned, there can be physical therapy, where physical therapy can use ultrasound or various maneuvers to the facial nerve to reduce the swelling and inflammation of it.
Okay.
That's kind of scary though, because if all you have to do is sit by and wait, you know, people don't like to be like that.
And it's in your face, so people see it, and everybody say you had, think that it's something more serious than that.
Is it uncomfortable as well?
Yeah.
Maybe it's not painful.
Okay.
We do have a caller holding, but I have a question about Bell's palsy. Can you grow out of it? Can you move past it? Because there's some famous people. George Clooney says he suffered with it when he was a child, but you don't see any evidence of it now.
It's full resolution.
Full resolution is possible.
It just goes back to normal.
Okay.